Did you know that every 40 seconds someone in the US experiences a stroke? That means over 795,000 people each year are affected by this devastating condition. Many of these strokes could have been prevented if the early warning signs were recognized in time. Imagine if your body could warn you weeks in advance that something was wrong. The truth is, it often does. Strokes don't discriminate. They can happen to anyone, whether you're young or old, male or female, healthy, or dealing with medical conditions. But here's the good news. If you know what to look for and take immediate action, you can save your life or the life of someone you love. In today's guide, we'll uncover 7 early stroke symptoms that can show up as early as 1 month before a stroke occurs. These signs are often subtle and easy to overlook, but knowing them could be the key to survival. So stay with me, and don't forget to share this information, because raising awareness could save lives. Number 1, persistently high blood pressure, a major red flag. Let's start with one of the biggest risk factors for stroke, high blood pressure, also known as hypertension. Many people don't realize that having consistently elevated blood pressure can put immense stress on the arteries, weakening them over time. It's like water eroding a riverbank. If the pressure stays too high, the walls of your arteries can either narrow and clog up or burst entirely, both of which can lead to a stroke. There are 2 major ways high blood pressure contributes to stroke. Ischemic stroke. This occurs when narrowed arteries lead to the formation of a clot that blocks blood flow to the brain. This is the most common type of stroke, responsible for about 87% of all strokes. Hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding inside the brain. The increased pressure can lead to severe brain damage and life-threatening complications. So, how can you tell if your blood pressure is dangerously high? Here are some warning signs. Frequent headaches, shortness of breath, dizziness or blurry vision, irregular heartbeats or chest discomfort. But here's the catch. High blood pressure often has no symptoms at all, which is why it's called the silent killer. That's why regular blood pressure checks are essential, especially if you have a family history of hypertension. The good news? You can take control starting today. Reduce sodium intake, cut back on processed foods and excessive salt. Manage stress. Try deep breathing, meditation, or gentle exercises like yoga. Stay physically active. Even 30 minutes of walking per day can make a difference. Monitor your blood pressure. If lifestyle changes aren't enough, consult a doctor about medications that can help regulate it. Remember, high blood pressure doesn't always show obvious symptoms, but ignoring it puts your life at risk. Taking action today could prevent a stroke tomorrow. Number 2, excessive fatigue, your body's cry for help. Feeling exhausted all the time? You might think it's just stress, aging, or lack of sleep, but persistent fatigue can be an early warning sign of a stroke. Fatigue happens when your brain isn't getting enough oxygen-rich blood. If the arteries supplying blood to your brain become narrow or blocked, even temporarily, your brain has to work harder to function, leaving you feeling worn out, sluggish, and mentally drained. This is especially concerning if your fatigue comes with other stroke warning signs like dizziness or feeling lightheaded, difficulty concentrating, sudden muscle weakness, unexplained drowsiness even after a full night's sleep. Why does this happen? A mini stroke, also called a transient ischemic attack, TIA, can cause brief interruptions in blood flow to the brain. This might not cause immediate damage, but it's often a warning sign of a major stroke coming soon. Many people experience TIAs weeks or even months before a full-blown stroke, but they dismiss them as just being tired or worn out. What should you do? Take note of unusual fatigue. If you feel mentally foggy, physically weak, or constantly drained for no clear reason, don't ignore it. Assess other stroke risk factors. Do you have high blood pressure, diabetes, or high cholesterol? Consult a doctor. If your fatigue is persistent and unexplained, it's time for a checkup. Early medical attention can prevent a more serious event. Fatigue might seem harmless, but when it's linked to poor circulation or restricted blood flow, it's a red flag. Pay attention to your energy levels. Your body may be warning you of a stroke before it happens. Number 3, vision problems, a warning sign from your eyes. Your eyes can reveal a lot about your health, and sudden vision problems may be an early warning sign of a stroke. Many people overlook or dismiss changes in their vision, thinking it's just aging, tiredness, or the need for new glasses. But if you suddenly experience blurry vision, double vision, or even temporary blindness, it could mean that blood flow to your brain is being disrupted. How strokes affect vision: strokes can block oxygen-rich blood from reaching the optic nerve or the visual processing centers in the brain. This can cause blurry or double vision, partial or complete loss of vision in one or both eyes, difficulty focusing, or sudden trouble reading, dark spots or floaters that weren't there before, a curtain-like shadow over your vision. One of the most serious stroke-related vision symptoms is called amaurosis fugax, a temporary loss of vision in one eye caused by reduced blood flow. People who experience this describe it as a curtain coming down over their eye, lasting for a few seconds or minutes. Why is this dangerous? Many people ignore vision changes, assuming they will go away, but in reality, they might be experiencing a transient ischemic attack, TIA, or mini stroke, which temporarily blocks blood flow. These episodes often precede a major stroke within days or weeks. What should you do? Don't ignore sudden vision changes. If your eyesight suddenly worsens, even for a short time, it could be a stroke warning sign. Get checked by a doctor. A stroke specialist or eye doctor can determine if your symptoms are caused by a serious underlying issue. Monitor your blood pressure and cholesterol. Both high blood pressure and high cholesterol increase the risk of strokes affecting vision. Your eyes are directly connected to your brain. If something affects your eyesight suddenly, it's not just your eyes, it's your brain trying to warn you. Recognizing vision problems early can help prevent a major stroke and protect your health. Number 4, severe headache, a pain you shouldn't ignore. Most people experience headaches at some point, but a sudden, intense headache, especially one unlike any headache you've had before, could be a warning sign of a stroke. What makes a stroke-related headache different? Unlike normal headaches caused by stress, dehydration, or lack of sleep, a stroke-related headache comes on suddenly and severely, like a thunderclap, is the worst headache of your life, may be accompanied by nausea, vomiting, or dizziness, may cause confusion, trouble speaking, or vision problems, does not improve with pain medication. This type of headache is often associated with a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts. The bleeding increases pressure in the brain, leading to sudden, severe pain. If not treated immediately, it can lead to brain damage or death. Who is at risk for a stroke-related headache? People with high blood pressure, aneurysms, weakened blood vessels in the brain, blood clotting disorders, a history of migraines, though not all migraines are stroke-related. What should you do? If you experience an extreme sudden headache that is unlike any you've had before, seek emergency medical attention immediately. If the headache is accompanied by weakness, confusion, or numbness, don't wait. Call 911. Monitor your blood pressure. Uncontrolled hypertension is a leading cause of strokes. A headache might seem like a minor issue, but if it's severe and sudden, it could be your brain's way of warning you. Recognizing this early sign of a stroke and getting medical help immediately could save your life. Number 5, numbness or weakness in extremities. A silent warning. Imagine waking up and feeling numbness in your arm or leg, or struggling to lift an object that normally wouldn't be a problem. This kind of weakness or numbness, especially on one side of the body, could be a warning sign of an impending stroke. Why does this happen? A stroke disrupts blood flow to the brain, depriving it of oxygen and nutrients. When certain areas of the brain are affected, they can't properly control muscle movement. This can cause sudden weakness, numbness, or tingling in the face, arm, or leg, typically on one side. Key signs to watch for: weakness or heaviness in an arm or leg, difficulty gripping objects or dropping things unexpectedly. One side of the face feels droopy or numb, sudden tingling or pins and needles sensation. Mini strokes, the silent threat transient, ischemic attacks, TIAs, or mini strokes, cause temporary numbness or weakness and often last only a few minutes. Many people ignore these episodes because they pass quickly, but a TIA is a major warning sign of a full-blown stroke. Studies show that 1 in 3 people who experience a TIA will have a full stroke within a year. What should you do? If numbness or weakness appears suddenly, don't ignore it. Call 911 immediately. Even if symptoms go away quickly, see a doctor right away. A TIA means a larger stroke could be coming. Know your risk factors: high blood pressure, diabetes, smoking, and high cholesterol increase stroke risk. Numbness and weakness aren't just a passing discomfort. They could be a life-changing warning. Getting medical attention fast could save your life and prevent permanent disability. Number 6, speech problems, a critical red flag. Imagine trying to speak, but your words come out slurred, or you can't find the right words even though you know what you want to say. Speech problems, also known as aphasia, can be a major warning sign of a stroke. Why does this happen? Strokes can damage the areas of the brain responsible for language and speech, making it difficult to communicate. Blood flow disruption impairs the ability to form words, understand speech, or even read and write. This can be temporary, as in a TIA or mini stroke, or permanent if a major stroke occurs and isn't treated in time. Key signs to watch for: slurred speech. Words sound garbled or unclear. Difficulty speaking. Trouble forming sentences even though the person is thinking clearly. Inability to understand speech. You hear words but can't process them. Mixing up words, saying the wrong words, or forming sentences that don't make sense. Sudden trouble reading or writing. Difficulty understanding simple words or instructions. The danger of ignoring speech. Issues. Many people dismiss speech problems as being tired, stressed, or just having a bad day. But these symptoms can appear suddenly and may last only a few minutes before returning to normal. That doesn't mean the danger is gone. Mini strokes, TIAs, can cause temporary speech issues that disappear quickly, but a full stroke is often just around the corner. If ignored, a stroke can cause lasting damage to speech and comprehension, or even leave a person unable to speak at all. What should you do? If someone suddenly starts speaking strangely or seems confused, don't wait. Call 911 immediately. Ask the person to repeat a simple sentence like, "The sky is blue." If they struggle to say it correctly, assume it's a stroke. Even if the symptoms go away after a few minutes, get emergency medical help. A TIA is a serious warning that a full stroke could follow. Speech problems are one of the biggest red flags for a stroke, and time is critical. Act fast and you could prevent permanent damage or even save a life. Number 7, neurological issues. A silent stroke warning. Imagine suddenly feeling disoriented, forgetful, or even losing your balance for no clear reason. While many people assume these are just signs of aging, they can actually be serious neurological warning signs of an impending stroke. Why does this happen? Strokes affect the brain, which controls balance, memory, coordination, and thinking abilities. When blood flow is disrupted, it can temporarily or permanently impact these functions. Mini strokes, TIAs, can cause brief neurological symptoms that many people ignore until a full-blown stroke occurs. Key signs to watch for: dizziness or vertigo, feeling like the room is spinning, difficulty walking straight or feeling off balance, loss of coordination, suddenly feeling clumsy, tripping more often or having trouble with basic motor skills, memory problems, forgetting simple things, like why you walked into a room or misplacing objects frequently, sudden confusion or difficulty concentrating, struggling to follow conversations, understand instructions, or make decisions, feeling mentally foggy, like your brain isn't functioning as sharply as usual. Why these symptoms are dangerous. Many people mistake these for just getting older, but in reality, they could be your brain crying out for help. Mini strokes can cause silent strokes, small strokes that don't show obvious symptoms at first, but build up over time, leading to major cognitive decline. If ignored, these warning signs can quickly escalate into a full-blown stroke that results in permanent disability or even death. What should you do? If someone suddenly seems confused, forgetful, or has trouble balancing, don't ignore it. Seek medical attention immediately. Even if the symptoms go away after a few minutes, they could signal a mini stroke, which means a full stroke may be coming soon. Encourage regular neurological checkups, especially for people with high blood pressure, diabetes, or a history of stroke in the family. Neurological changes are not just a part of aging. If they appear suddenly, they could be warning signs of a stroke, and ignoring them could be a fatal mistake. Act fast, and you could save a life. Understanding stroke types and causes. Strokes are serious medical emergencies that happen when the brain's blood supply is suddenly cut off. There are two main types of strokes, and knowing the difference can save lives. First, ischemic stroke, the most common type. 85% of cases. Cause: a blood clot blocks blood flow to the brain, depriving it of oxygen. How it happens: clots can form in narrowed arteries due to plaque buildup, atherosclerosis. A clot can also travel from the heart due to conditions like atrial fibrillation, irregular heartbeat. Danger: without oxygen, brain cells begin dying within minutes, leading to permanent brain damage if untreated. Second, hemorrhagic stroke. Less common, more deadly cause. A blood vessel bursts in the brain, causing bleeding that damages brain tissue. How it happens: uncontrolled high blood pressure weakens artery walls, leading to ruptures. Aneurysms, weakened, bulging blood vessels, can burst suddenly. Head injuries or overuse of blood thinners can also increase the risk. Danger: this type of stroke increases pressure inside the skull, which can quickly become life-threatening. Major risk factors that increase stroke chances. While some risk factors can't be controlled, many lifestyle changes can significantly lower your risk. Uncontrollable risk factors. Age. Risk increases after age 55. Family history. If a parent or sibling had a stroke, your risk is higher. Previous stroke or TIA. A mini stroke and TIA or prior stroke means you're at high risk for another stroke. Controllable risk factors. High blood pressure, the #1 stroke risk. Uncontrolled high blood pressure damages arteries, making them more likely to clog or burst. Tip: monitor blood pressure regularly and keep it below 120/80. High cholesterol leads to plaque buildup in arteries, increasing the risk of clots. Tip: eat healthy fats, avocados, nuts, and limit fried processed foods. Smoking doubles stroke risk by narrowing blood vessels and increasing clot formation. Tip: quitting smoking immediately reduces risk significantly within a few months. Diabetes high blood sugar damages blood vessels, making strokes more likely. Tip: control blood sugar levels through diet, exercise, and medication. Obesity and inactivity. Being overweight raises blood pressure, cholesterol, and diabetes risk. Tip: aim for 30 minutes of exercise daily. Even simple walking helps. Atrial fibrillation, AFib. This irregular heartbeat causes clots to form in the heart, which can travel to the brain and cause strokes. Tip: if you have palpitations or irregular heartbeats, see a doctor immediately. Heavy alcohol consumption. Excessive drinking raises blood pressure and increases clot risk. Tip: limit alcohol to 1 drink per day for women, 2 for men. Why you should take action. Now, 80% of strokes are preventable. The key is early detection and lifestyle changes. Monitor your blood pressure, cholesterol, and blood sugar levels regularly. Recognize early stroke symptoms and seek immediate help if they appear. Maintain a healthy lifestyle. Your future depends on it. A stroke can happen to anyone, but by taking control of your health today, you can dramatically lower your risk and potentially save your own life or someone else's. Stroke prevention tips: how to reduce your risk. Preventing a stroke is easier than treating one. By making a few lifestyle changes and staying proactive, you can significantly lower your risk. Here's how. 1. Control blood pressure. The #1 stroke risk factor. Checkmark high blood pressure is responsible for nearly 50% of all strokes. It weakens blood vessels, making them more likely to rupture or clog. How to lower blood pressure. Monitor it regularly. Keep it below 120/80 if possible. Reduce salt intake. Avoid processed foods and choose fresh whole foods. Stay active. 30 minutes of moderate exercise, like walking, can help. Manage stress. Try meditation, deep breathing, or yoga. Limit alcohol and caffeine. Both can raise blood pressure if consumed excessively. 2. Maintain a healthy weight and stay active. Being overweight increases your risk of high blood pressure, diabetes, and high cholesterol, all major stroke contributors. How to maintain a healthy weight. Exercise regularly. Aim for 30 minutes of activity at least 5 days a week. Incorporate movement into your daily routine. Walk instead of drive, take the stairs, and stretch often. Choose whole, unprocessed foods. Avoid sugary drinks, fried foods, and excessive carbs. 3. Eat a stroke-fighting diet. Your diet plays a major role in preventing strokes. Certain foods help reduce inflammation, lower cholesterol, and improve heart health. Best foods for stroke. Prevention: healthy fats, avocados, nuts, olive oil, help lower bad cholesterol. Omega-3 fatty acids, salmon, sardines, flax seeds, reduce blood clot risk. Leafy greens and vegetables, spinach, kale, broccoli, rich in antioxidants. Berries and citrus fruits, blueberries, oranges, help lower inflammation. Whole grains, brown rice, oats, quinoa, help maintain stable blood sugar. Foods to avoid: processed meats, high in sodium and preservatives. Sugary foods cause inflammation and weight gain. Fried foods increase bad cholesterol. 4. Quit smoking. One of the most important steps. Smoking doubles your risk of stroke by damaging blood vessels and increasing clot formation. How to quit smoking. Successfully. Set a quit date and stick to it. Use nicotine replacement therapy, patches, gum. Find a support system, family, friends, online communities. Replace the habit with healthier activities, exercise, meditation. Even secondhand smoke increases stroke risk. Avoid exposure whenever possible. 5. Manage blood sugar and diabetes. Diabetes increases stroke risk 2 to 4 times because high blood sugar damages blood vessels. How to keep blood sugar in check. Monitor glucose levels regularly. Limit refined carbs, white bread, pasta, sweets. Eat fiber-rich foods, vegetables, beans, whole grains. Stay hydrated. Water helps regulate blood sugar naturally. Exercise daily. Helps improve insulin sensitivity. 6. Sleep well and reduce stress checkmark. Poor sleep and chronic stress increase inflammation, blood pressure, and heart disease risk. How to improve sleep and reduce stress. Aim for 7 to 9 hours of quality sleep per night. Create a bedtime routine. Avoid screens before bed. Keep the room dark. Try relaxation techniques, meditation, deep breathing, or light stretching. Reduce caffeine and alcohol intake before bed. 7. Get regular health checkups. Many stroke risk factors, high blood pressure, cholesterol, diabetes, develop silently. How to stay proactive with your health. Check blood pressure at least once a month. Get cholesterol levels tested at least once a year. Talk to your doctor about atrial fibrillation, AFib screenings. Ask about stroke risk assessments, especially if you have a family history. Take action today. Your health is in your hands. Strokes are preventable, but only if you take action. Small daily habits can dramatically reduce your risk and keep your brain healthy for years to come. Start today. Eat better, move more, manage stress, monitor health regularly. What's one change you can make today to protect yourself? Let me know in the comments. If you found this helpful, don't forget to like, share, and subscribe to Vitality After 50 for more life-saving health tips.